This video will demonstrate how to properly assess body composition using the Skinfold measurement test. Things to remember for the Skinfold measurement test are as follows. All measurements should be taken on the right side of the body. The patient's skin should be dry and lotion-free. Locate and mark all sites before measurement. Hold the caliper in your right hand with the dial facing upwards. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. The pin should be maintained while reading the caliper. Be sure to hold each measurement for 1 to 2 seconds, rounding each measurement to the nearest half millimeter. Take a minimum of 2 measurements at each site. Record each measurement in rotational order, allowing the skin to regain normal texture and thickness. Take the average of each site measurement to calculate body density and body fat percentage. The 7 measurement sites will include the triceps, the subscapular, the chest, the mid-auxiliary, the abdominal, the suprailiac, and the thigh. Beginning with the triceps site is a vertical fold located on the posterior midline of the upper arm, halfway between the acromion and olecranon processes. Make sure the arm is held freely to the side of the body. The subscapular site is measured with a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. The chest or pectoral site is a diagonal fold, with the mark located 1/2 the distance between the anterior auxiliary line and the nipple for men, or 1/3 the distance between the anterior auxiliary line and the nipple for women. The mid-auxiliary site is measured with the vertical fold on the mid-auxiliary line at the level of the xiphoid process of the sternum. The abdominal site is measured with the vertical fold with the mark 2 centimeters to the right of the umbilicus. The suprailiac site is measured with the diagonal fold with the mark located in line with the natural angle of the iliac crest, taken in the anterior auxiliary line, immediately superior to the iliac crest. The last of the 7 sites, the thigh, is measured with the vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease at the hip. It is important to note that when assessing body fat percentage using Skinfold measurements, there is a margin of error of plus or minus 3.5%, assuming that the protocols were followed properly with the correct equations. To find the body density from the Skinfold measurements, calculate the average of the 2 trials, then proceed to finding the sum of each of the 7 sites. Calculate body density using the 7 site formulas shown above and plug them into the body fat percentage equations shown below. The following are the most commonly used equations for finding body density and body fat percentage, respectively. Population-specific equations are also available and may provide a more accurate description of body density and body fat percentage.